competing!
Hi guys, hi Competing Joy. Welcome back to another video. Today we are having a podcast which is a little different from the kind of video that we used to do in the past. So we are going to talk about a very important childhood disorder. Most of you must have heard about autism, and to talk about it, I'm joined by Dr. Jina, a child psychiatrist. So thank you for joining us today.
Thank you for having me.
So can you please introduce yourself a little bit? Tell us about you.
Sure. So hi, I am Dr. Jina. I currently work for the State Health Service. I am a psychiatrist. I have completed my fellowship in child and adolescent psychiatry. Do you want me to tell a little bit about my journey?
Yes.
Right. So I completed MBBS from DY Patil, Pune, and I did my 3 years of MD in psychiatry from Balaji Medical College in Chennai. And after that, I came back to Imphal. And I was in Imphal, so 2019 I completed my MD and I was in Imphal for a year. And in 2021 I went to do fellowship in child and adolescent psychiatry from St. John's Medical College, Bangalore. And for completing a year over there, I came back to Imphal by the end of 2022.
So
and
it's been 3 years now.
I've been practicing.
3 years now. So, okay, I think like child psychiatry is, there's not much of it also now in Manipur also as of now.
Child psychiatrist. There's one more, Dr. Sana. Dr.
Okay,
Sana.
just
Yeah.
Okay. So yeah, like I just feel like our state Manipur or us, the whole Northeast has to raise this issue or think about it, talk about this particular thing. So I just wanted to ask from you, like from your experience, how do you see the current state of children's mental health in Manipur or the Northeast as a whole?
Right. There has been quite a shift from what it was initially before I went to do, maybe because I'm more aware of it now after having that 1 year course of child and adolescent psychiatry. However, I do see a shift in the part of parents, in the part of the children and adolescent itself too. So there are many cases of child mental health issues where they're not really brought by parents, but the children or adolescent would tell their parent that I think I will need to see a psychiatrist or I need to consult a psychologist. Okay. And there are many cases that way. So I think one is more awareness of the disorder and more willingness to learn about childhood and adolescent mental health issue and more input from the side of a school and teacher and them the willingness on the part of teacher also to know more about mental health issues in children. Exactly. So there has been quite a shift in that pattern.
Yeah, like you mentioned that it is more of the children's, telling the parents about it. So the main shift that I want to talk about later on in this podcast is about how the parents has to play this role when it comes to understanding this. But before we come to that, many of us doesn't understand properly like autism or ADHD. So tell us in very simple terms to let us understand what is autism or ADHD.
Yeah. So when we say autism or ADHD, we are talking about a neurodevelopmental disorder. So what do we mean by a neurodevelopmental disorder? So neurodevelopmental disorder is a disorder that arises during the developmental phase of a child, right? So it could be because of genetic factor, it could be because of change in the gene of the child itself, right? Okay. Or it could be a familial thing, right? So both are neurodevelopmental disorder. However, I have also come across parents and children who are referred by the teacher who would think that a child has a certain disorder. They know that the child has a disorder, but they would oftentimes confuse between ADHD and ASD or Autism Spectrum Disorder, as we know. So what is the difference between the two? First, I'll tell you about autism. So when we say autism, there are two core issues that has to be present, right? Two core problems. One is social interaction and communication deficit, right? And the second core problem that a child with autism will present is something called as a stereotypy or restricted or repetitive behavior or lies. And that can change over due course of time, right? So these two core problems has to be present for a child to be diagnosed as being in the spectrum, right? Whereas ADHD is quite different from autism. Okay. ADHD, as the name itself suggests, attention deficit hyperactive disorder, right? So there will be there will be deficit in sustaining attention that you see in the child. Along with that, you will also sometimes will notice hyperactivity. Okay. Not every ADHD child will have hyperactivity. Sometimes the inattention part tends to be more than the hyperactive part, or vice versa. Or it can both be present, right? So these are the two different neurodevelopmental disorder, which oftentimes does get confused. And the reason for that confusion that always surfaces is because many a times a child who is in the spectrum, who has autism, will have comorbid ADHD. Many a times. Not necessarily that every child who is in the spectrum will have ADHD, but we see that oftentimes they do have comorbid ADHD along with autism. So these are the two different neurodevelopmental disorder that we will be talking about today.
Okay. Yeah, so like to go into details, it will take hours and hours.
Yeah, it does take hours.
Yeah. So I mean, like if we want to know more, maybe we can do a research also on the internet.
Yeah.
But before we go to the details, I mean, how are the parents taking it? Like according to your 3 years experience so far in Manipur, like be it people from the hills or from the valley, how are the parents taking? Are they accepting this from their child, or are they somehow trying to deny or getting offended by it?
I have not just over here in Manipur, but also in when I was doing my fellowship period, right?
Okay.
So first of all, ASD is a clinical diagnosis. So you know what the core problem that we talked about. If that is present, we do know that it is in the spectrum. But for parents to, again, that acceptance part, for them to come, to have more acceptance of the disorder, we do have assessment skills. We do ask them, question, fill up the questionnaire, and accordingly we'll give, this is where the area of deficit is. That's more like, you break down and then you explain it to them. However, in spite of doing that, also there are parents who find it quite difficult to accept it, and I do understand. It's absolutely. There were parents who, when I was practicing, when I was doing my fellowship back there in Bangalore, there were parents who screamed at me when I gave them the diagnosis first, and I do understand. I do understand where they're coming from. It's not easy for parents to accept that the child is neurodivergent. In a world of neurotypical kids, to know that your child is different in a way, so that itself is quite difficult for parents to accept. I think a lot of that difficulty also stems up from how the society reacts to it, how your community react to it, the people around you react to it. So that itself is a big deal for parents to accept.
So like, are there easy symptoms or behaviors that we have to check out for a kid, or at what age, at what period do we start to see that symptoms or spectrum, like you said?
Yeah, so you can note if you are somebody who knows a little bit of it, and or not just about, you don't really have to read up on, but I think a lot of it has to do with being observant, being an observant parent, being an observant caretaker. The red flags, as we call it, of autism can be noticed at as early as 18 months. Like babbling, responding to sounds, responding to name call, pretend play. If by 1.5 years of age, if the child does not have pretend play, whereas other children, they do it. If you call the child and if there is no response from the child, and so when that happens, a lot of time parents do take them to get their hearing checked, right? They know that it's clear. However, they always see that the child does not respond when you call them. However, you play their song, their favorite song, or favorite music or something, then immediately they'll turn. So you know that there is no hearing issue, but there is no response per se from the side of the child. There is no pretend play. There is no joint, interest or joint attention, in terms of like, for a child, everything is new, right? From seeing a river to seeing a bus, from seeing a cat to a dog, everything is new for a child, right? So when they see something new, something interesting to them, usually what they do is they tend to engage the people around them and tell them, okay, see, look, there's something new over there. But for a child who is in the spectrum, they won't really have that joint interest or joint attention. So these are the red flags that we see earlier on for a child who is in the spectrum. Then by
for both, not for ADHD and autism.
No, for autism. Yeah. If you're going to do ADHD, that's going to take a lot of time.
Let's focus on autism.
So we're going to focus just on one disorder. So So what happened is so you can start noticing this as early as 18 months.
Okay.
Right?
Okay.
But the more obvious, I mentioned about the two core problem, right? The social interaction communication deficit and the stereotypy or the repetitive behavior.
Yeah.
That two core problem, the obvious of it would start appearing at a bit later age, around 3.5 to 4 years of age. However, at the earlier age, these are the red flags that you will be noticing in a child with autism.
So, like, what should a parent do when you start to feel like your kid is in the spectrum? So, like, what would you advise? Because most parents are not free at that age. They'll be earning, they'll be working in the office. But I think, like, I mean, how important is time given to the kids at that age, around 18 months is?
Right. I mean, I'm in no position to give parenting advice to parents because I'm not a parent myself. However, I do feel that being present for your child is important. That's when you will be able to notice this changes or deficits, as you may call, how other children. And when I say comparison, I'm not talking about a negative comparison. So when you compare a child of 2 years old who you know is not in the spectrum, who have quite interesting social reciprocity and communicate, even if the child is not able to say a sentence, but is able to respond to you, joking around with the child, calling the child, giggling, laughing at your jokes, as compared to a child who at the same age does not respond like that. So there is a deficit in that area. Who will be able to notice? A more observant parent will be able to notice. Not just parent, any caretaker of the child. So being present, not just physically, but emotionally being there to be more observant of how the child behave and how the child tend to differ a little bit from others. I think a lot of time, this is the reason why there's a lot of, gap in the treatment also, in terms of parents not being able to notice. And I also feel they do see it, they do notice it. But again, the question of acceptance come into picture. And when they do go to school, when they go to preschool or nursery school, teacher will notice that. And they'll be the one informing the parent that I think you should.
I think the school also plays a very important role.
It does. Yeah. And again, observant teacher. True. Not just being there as a teacher, but a more observant, a more, in sync with the student. Teacher who are like that, they tend to tell parents, and then they tend to give advice to parents that I think it would be better if you would consult somebody for the same, because this is what I notice. And many a times, many children are bored with the complaint from the school by the parents saying that the child does not mingle and play with anybody. However, the child does want to play alone, because children at that age, at that young age, when they are given the chance to mingle with their peer, they would happily do it, right? There's, the core, personality of introversion, extroversion, broadly, if you're talking about it. They may take some time, however, they do want to, have an interactive play. For a children who is in the spectrum, they would rather play alone than to mingle with other children. So they will be given a lot of chances to be with other children, to play along with other children. However, they always choose to play solo. That's when teacher will also inform the parent, this is what we notice. And if if at home, let's say for example, there are no other children, so for parents it might be a little difficult to notice if the child does play along with other kid or not, because there's only one child and there are no other children for a child to play along with. And if the parents are busy, they're not really able to engage with the child, they won't really notice all this. But once they start going off to school, Anganwadi or even play school, that's where the teacher will start noticing. Many of my clients also have come to me with parents complaining that teachers have said all these things.
So mostly it comes from teachers now. That's interesting. I think like these things turn out to be very simple at times, but it's not. Now we need to be very attentive to these things.
Yeah.
So like I think most of the children or kids nowadays are trapped into screen times, be it mobile phones, be it TVs, be it tablets. So most parents, we just throw them a device so that they'll just be concentrated. So tell us like how impactful it is to reduce screen time for like children with autism.
Yeah. So having said that, it's not that screen time will make your child have autism, right?
Okay.
That as I mentioned in the earlier, starting of the podcast also, that it is a neurodevelopmental disorder. So if you expose your child to screen time or do not expose your child to screen time, there is no,
there's no root cause, but
So what the issue with that, with exposing your child to a lot of screen time and how it does tend to be harmful is that stimulation difficulty is what autism children who are in this spectrum faces, right? So I think it would be better and beneficial for them to make them engage with peers of their age, right? And have a more wholesome experience rather than to fixate them on a screen. Because that the learning is what is important for them. Sometimes it tends to be very difficult for them to, and not that they have an IQ issue, right? Again, having said this, comorbidly there are children who are in the spectrum with intellectual disability, but not every child who is in the spectrum will have intellectual disability, right? So intellectually wise they might be okay, they might be even brilliant also, but for them learning in the typical manner, like how other typically growing children, they're not like that. So I think stimulation is what is required for them, and to make them fixated on the screen is again not an advisable step for parents or any caregiver to.
So like now, like you said that there's only you and another person and the doctor, so it's really scarce, right? So for example, I'm from Senapati. Let's say as a parent, I somehow feel that my kid is in the spectrum. So like, where do I go? How do I go? Because I may not know that there's a child psychiatrist also. I'm introduced to you by Paulina, who is a psychologist, right? So I mean, like, what advice would you give, or where to go, like how to go about for any parents whom they feel their child is going through this?
It's quite interesting topic that you have brought up right now, and also it's of much discussion now that psychiatry itself should be taught during the MBBS phase, right? We do have posting for certain number of days, but I think more importance in psychiatric disorder as a whole should be given to students who are doing MBBS, and along with that, for working in the community, if you're working in the community, better understanding of autism, it can come from a doctor, it can be a child psychiatrist like myself, or it could be even from a psychiatrist or even a pediatrician who have knowledge on autism, can talk about this on the community level. And so it's important for them to know that, okay, these are what we need to look out for. And if we do notice this in our child or our neighbor or any other child, the best that we can do for the child is to talk to the parents and then refer them to any nearest healthcare center, right? And for that, a multidisciplinary team, it is of much requirement, because I can't be the only one who will be seeing the child, right? Because many children will need speech therapy. But again, having said this, every children in autism do not necessarily have speech delay also, right? But speech therapy is required, occupational therapy is required, making the community understand about the disorder, right? So a multidisciplinary team. And again, if the child has any physical disorder along with being in the spectrum, developmental pediatrician will be required in the process. Teacher, like special educator, psychiatric social workers. A team is required to have to bring about maximum, benefit for the child. However, because of lack in every area, in every field, because that in speech therapists and occupational therapists, how many do we have also, especially in the hilly area.
The time consumption.
Right. So, but we do need to have a link with every one of them, so that what is the best we can do. I have seen parents who have worked in other part of India, but have either they leave Manipur and shift for the child, for the sole purpose of the child to have all these therapy done, or one of them come back here, leave the work, do remote working, and completely focus on the child for that certain age where maximum and rigorous therapy is required. So it's quite difficult. It's not easy for every family. It's not easy for every family.
It is not easy at all.
It is not easy at all. But that's why we need more resources for these, and the maximum that we can do is to have a clear-cut diagnosis first, and to have a diagnosis, and for parents to understand that this is a particular disorder, this is what we see in this disorder, and these are the ways in which you can help the child. Right?
Yeah, like the main the sole purpose of doing this podcast is more like an awareness for me also. I feel like we need to send this message. Maybe the government is doing a lot to bring awareness now, because they've been doing for HIV, they've been doing for other stuff, but I think this children's mental health is like something that we have to really be focused on. And then I was like, the first time when I met you, I thought like I wanted to do a podcast with you. So now, what advice would you give to parents, like like especially young parents who may be going through this or may not be, but what advice you can give to them so that they can also be aware of it? Because like people watching this podcast, maybe be it parents or not, one day they'll be, or they're already parents, so maybe they'll share this video if somehow their niece or nephews or their children are going through this, not so like you just give an advice to the parents how they should go about if their kid is somehow they suspect to be in the spectrum.
Yeah. Again, whenever you say advice, I get a little,
No. Yeah.
Not because of that, but I'm not. Like I said, I'm not really in a position to give any advice to parent, but I can most definitely give advice for this order and for parents is to be more observant of your child.
Okay.
Be more observant, be more present, and because and I'm not just saying this for autism, I'm just generally saying for a development of a child, every child needs a safety net. There's something called circle of security that we talk about in attachment, and attachment disorder in psychiatry. We're not going to dive into that because that's going to be a huge topic altogether. But there's something called a circle of security where a child feels secure enough to step out, pursue whatever they want to. If they fail, they feel safe enough to come back home, right? And it should be the parent who should be providing that circle of security, right? That's more secure attachment that you have with your child, right? Children in the spectrum, they will have temperamental dysregulation, right? So basically when we say temperament, we are talking about how a child reacts, in a certain situation, the emotional expression in a certain situation, or with a person, right? So they will not be, it's not going to be easy for them to regulate those temperamental issues, right? But as long as you have that sort of secure attachment with one of your caretaker, or both the caretaker, both the parent, if it's a single parent, or one of the parents, right, or grandparents, whoever, the main caretaker, right? So the child feels safe and secure enough to step out, do what they want to do, fall, make mistake, but still feel, yes, I have done it, I've made mistake, but I still have my safety net, and that is my parent, right? So I think that is important for parent to, and that can only happen if you don't, I mean, physical presence is important, but it's not just about the physical presence. You can come back home, be present as a person in the room. However, if there is no emotional attachment to a child, there is no, like more in-depth attachment to a child, I think that a lot of problem can come out from there also.
That's true. It's not just about numbers, right?
Yeah.
Okay, so before we come to the end of this podcast, like what is the rate of improvement? Let's say I'm a parent, let's say my kid is going through this, so like I try to follow like what you just said also as much as I can. So like do you think like a kid with autism can really improve if we give proper time and proper proper advice?
Right. So we what we need to understand is the core issue that I've spoken about, the social communication deficit and the rigidity or the stereotypy, right? That is going to be present throughout, right? It's a lifelong disorder. However, why are we introducing the child to therapy? Why are we telling parents to go ahead and make the child mingle with other children? Make them, bring them in social situation where they can interact with other children. Why are we pressing this on parents is because even if the core problem is going to be present throughout, it gives them the chance to navigate through the issue that they will have lifelong, right? For example, if a child is in the spectrum and interacting with anybody is going to take time for them, right? But if we keep them exposed to social gathering and social situation, example, going to school, joining a class, whatever, painting class, drawing class, whatever that the child wants. Let's say the child will take days to mingle. when we keep on exposing them to social situation, we tend to cut down on the time that they might take to interact with other. They are going to take their time. They are going to. It's not going to be easy for them.
Yes.
To just go ahead and be with other children, play along with them. It does take time for them. However, with continuous exposure, with continuous chance to interact with other children, they do have certain level of comfort where they feel, okay, now I can, because there have been reports from parents that they have the therapists or the teachers have told them that now he does
which would not have happened if we
if you just keep the child at home, not given them the chance, which that definitely is not going to happen. Forget about neurodevelopmental disorder, any one of us, any child who is not given a chance to socialize, to mingle, to interact. And again, school is not just for academics. I always tell this to my the parents of my clients, that if one of you is a good teacher, good enough, and you are you're okay with your studies, you can always teach your child academic things. That's not a big deal.
Yes.
What's important is how you teach your child to mingle with other children, to interact with other children. That can only happen if you send them to school, or if you send them to a gathering where they are able to do the same. Right? So I think that is also quite important.
Yes.
And then it does, to be more comfortable with it. And they're very comfortable with routine. You must have seen children with autism, and you must have known children with autism who they are very comfortable with their routine. They don't like diversion from their routine.
Yes.
They're quite uncomfortable with their diversion. So for example, there are clients of mine who parents would say, from our place to your place, he knows the direction where the road that he has to take. But because of some issues in that area, we have took a diversion. He's very uncomfortable and starts crying throughout. So even that sort of, diversion from what he think is routine for him, that itself is quite uncomfortable for the child. Yeah.
Okay, I think you coming here and joining us today, I think this podcast will not just go in vain. Your time, your energy that you have come here and spend with us, it's really thankful to you for coming and educating us and also telling us about all these things. Okay, so I feel like the viewers here, if you feel like your family, your relatives, or your kids, whatever, if they're going through, I think you should immediately take precaution about it, like do things like our doctor has also said.
Earlier intervention is always better. The earlier you notice, if you do feel that there's something different for your child as compared to other children of his or her age, in terms of the social growth, even speech output, I think it would be the best thing that you can do for your child is immediately take the child to a nearby health center where there's a presence of a doctor, or if not a psychiatrist, somebody who knows about this disorder, and maybe get a link, like how you got link through Paulina, somehow like that. So that, I think that would be the way forward for us in our state. We spoke about lack of resources and therapists not being present, only in the the hill area there isn't, right? So there's a lot of gap that ways in the treatment reaching up to the optimum level. But the least that we can do for the child is being observant, notice it, earlier intervention the better. Yeah.
So somehow we have the bottom line is, even though we may not have the best facility as of now, wherever you are, we still have us, we still are the adults, are the guardians, so we can do so much when it comes to this, right? So thank you so much, Dr. Jina, once again for joining us, and I hope this video will reach people who are in need. Thank you so much for watching this video. Please do like, share and subscribe. Thank you.
Thank you so much.